All right, once again, thanks everyone for joining our House campaign call. My name is David Gonzalez Rice. I'm Senior VP of Policy at the National Low Income Housing Coalition. We hold these calls every couple of weeks. I'll start at the top with a little bit of housekeeping. The call will be recorded and posted later to YouTube. We can distribute the link so you can watch the recording later. Just a reminder that this is a publicly recorded event. We also have the Q&A function. Please use that to raise questions. You won't be able to unmute to ask your question, and we ask you to use the Q&A function so we can keep track of those. You're welcome to introduce yourselves in the chat. Hello, Talissa from New Jersey. And let's see, without further ado, I'm going to turn it to our guests. We have Elena Hampton-Stover from National Network to End Domestic Violence and Olivia Brochu with her from National Network to End Domestic Violence, their Director of Housing and Policy Specialist over there at our key partners. So here to talk about impacts of the government shutdown on that sector and on survivors. Go ahead. Thank you.
Hi, thank you so much for having us. I'm Olivia, a policy specialist at the National Network to End Domestic Violence, and I'll just pass it to Elena quickly to introduce herself.
Yeah, hi everyone. Thanks so much for having us here today. My name's Elena Hampton-Stover. I use she, her pronouns, and I am the Director of Housing at National Network to End Domestic Violence. And like David said, we're going to be talking about some of the impacts of the shutdown, specifically on survivors and their housing and our sector in the gender-based violence movement. So I'll kick it back to Olivia to start us off.
Great. Thank you so much, Elena. And again, thank you so much, NLIHC, for having us present today. So first off, I will start with some updates just about the shutdown and DOJ. So at the beginning of the shutdown, the White House said that they would use the shutdown however they could to further its restructuring of the federal government, which we have seen them do. Immediately after the government funding lapsed, DOJ shut down all of the grant-making offices. So this includes offices that provide federal funding and support to organizations that support victims of domestic violence, which are the Office of Community-Oriented Policing Services, the Office of Justice Programs, and the Office of Violence, and the Office on Violence Against Women, OVW. The Trump administration says these are just standard furloughs. However, we know from recent history that in any of the recent shutdowns, these offices have not been shut down. They've stayed open, have been deemed essential. And we have folks from the inside of OVW speaking anonymously, saying that they believe this is a target effort to permanently weaken these grant programs. We also know that the White House has announced plans to consolidate OVW with a few other offices within DOJ, which of course would weaken the program and put some questions up into the air about what would happen to those grants housed under OVW, and just, you know, a lot is up in the air related to that issue. In addition to the closing of these offices, there's also a legal fight going on that the shutdown has impacted. More than 20 nonprofit organizations that receive federal grants, and some of those are at NNEDV's, our coalition partners, our members. They've joined together to sue, to file a lawsuit in June against the Trump administration over new funding restrictions related to grants. And so more specifically, DOJ has said that they will change funding based on organizations who are participating in DEI. They're asking these organizations to deny transgender people's identities and cut off access to abortion services. So that's what started the lawsuit. And in August and earlier this month, judges issued temporary injunctions, which would stop those restrictions from going into place. But immediately after, like hours after the government shut down, DOJ sent out several court filings asking to block the court's order until the restoration of funding to federal agencies involved in the case. So they are clearly using the government shutdown to stop that order from taking place. Right now, there's not been any further action, but if this order is blocked, the new restrictions will start taking place in November. And I'm going to pass it to Elena to talk about some of the true impacts on programs and survivors of some of those things.
Thanks, Olivia. So I'm going to give a snapshot about how domestic violence programs and survivors directly have been impacted so far by the shutdown. So many of the projects that specifically are funded by OVW have project periods that end on September 30th. And some of you may already know that notices of funding opportunity were delayed significantly. The new administration pulled prior notices, and there was months where there were no notices up. Typically, we'd make applications and complete those by early March. And instead, many of the due dates this year were in late July through August. So as you can imagine, many of those notices for the funds that continuation programs might receive have not gone out, were unable to go out before the government closed, before the shutdown started. So for example, OVW has a transitional housing program which houses survivors, provides rental assistance from 6 to 24 months, along with voluntary supportive services. Some of those programs have been operating for decades, and they have survivors currently in housing, but now do not know, they haven't received notice of whether they've received their new award or not, that would have begun on October 1st. So those organizations are now in the situation where they are having to make decisions now, likely for another month, about whether they're going to pay rents or not, without the certainty of whether they'll ever receive the funds to be able to be reimbursed for those payments. This is also just a huge strain on programs. Often victim service providers, domestic violence service providers are very small nonprofits and don't have large cash reserves, lines of credit, to be able to continue operating without impact indefinitely, and particularly when they don't actually even know if they will receive the grants that would be needed. And other housing services have additional complexities. So many of you may be more familiar with the Continuum of Care funds, which were supposed to have a 2-year award that then the new administration decided they would only honor 1 year of that 2-year competition that occurred last year, and also have not made that notice of funding opportunity available to communities. So it is even more precarious for victim service providers and domestic violence service providers, because we have no guarantee that DV bonus funds that set aside will be available at all. So there's a lot of concern about really all of the housing funds for survivors, and great uncertainty without really any answers during the shutdown. Projects that are already funded under existing grants, they are still able to receive their funds, to draw down on their funds. However, if there's any kind of irregularity or difficulty in drawdown, or if there's any question that you may have about an allowable expense or a need to make a budget modification, you're unable to make any of those changes. So you are kind of stuck in limbo if there's anything, and if any of those items or actions were pending at the time of the shutdown, you are also stuck in limbo until the shutdown ends. So of course, the longer that the shutdown continues, the more difficult this is going to be for organizations providing direct services for survivors. And of course, they're trying to buffer that experience from survivors being impacted as much as possible. But the longer this lasts, the more difficult it's going to be for them to do so. As you all will know, I'll talk a little bit more about the impacts on housing funds, as you all are probably more familiar with households receiving things like public choice vouchers or housing choice vouchers, as well as public housing. do have rent payments through November. However, we start to reach into some uncertain spaces, and that's not even to kind of address all of the layoffs that have continued, and particularly the attacks on Fair Housing Enforcement Office, FHEO, where most of that staff was laid off and more were laid off during the shutdown. And they are the enforcement arm for VAWA housing provisions, the Violence Against Women Act housing provisions. So when survivors have their housing protections violated and need recourse, that is the office that would provide recourse. So not only during the shutdown, any pending investigations are just on pause. And for survivors, this is a real world situation where somebody could be in harm's way, unable to get the resources that they need to access their rights to move or to avoid an eviction, or to have their lease bifurcated so that they can remain in their housing safely, but without the abusive partner on that lease. If those rights are being violated and no one is there to investigate it, it leaves them with very little recourse. So those layoffs are being challenged in court. There's additionally probably seen whistleblower reports about those that also speak to the impact on survivors specifically and on their safety. There's also other difficulties kind of at a systemic level with individuals paying rent. So as we know, this past week was the first week that full paychecks were missed by thousands of federal workers. And people often forget that federal workers can also be survivors. Federal workers can be in an abusive relationship or attempting to flee an abusive relationship. And we know that economic factors greatly influence and inhibit people's ability to leave abusive relationships, and also are contributing, precipitating factors to unhealthy relationship dynamics erupting into violence or more lethal situations for the victim survivor. So this additional economic strain is absolutely going to adversely impact survivors who may also be federal workers or even just have a federal worker in their household. So there's additional economic strain in their household. And we also know, of course, other federal programs that are being threatened and starting to come up on those times that their available funding is running out, most notably SNAP benefits and food assistance funds not going out in November. You know, these hugely impact low income families who you know, many people who are leaving abusive situations really rely on those safety nets to continue to meet their and their children's basic needs, and could be in really dire circumstances without them. So we wanted to provide some resources in the chat. Of course, we always like to name the domestic violence hotline. It's really important for any advocate to be aware of ways to refer both in their professional life and in their personal life to make sure that they know how they could get survivors to relevant resources in their community. So especially when you're in national work, the hotline is a great way to make sure that somebody who is qualified is helping connect them to the most relevant resources local in their community. We also have a resource library where you can learn more, and Olivia will be dropping these things in the chat. So if you want to access those links, they'll be available there. There are also a number of state-based resources and organizations that can help you kind of navigate at the local level. As well as Feeding America has a way to identify local food programs, food assistance programs, and food banks. And that is another great way to be able to help support people during this time. And just always remembering you really never know when you're interacting with a survivor. And it's important that you always have that awareness that anyone that you could be impacting, interacting with in your work could be a survivor. And so knowing these resources will help you be able to connect those in your life, many of whom will be survivors, to these needed resources at this time. And we also just wanted to share, many of you have potentially already seen the tenants' rights flyer, but we wanted to share that as well because it's really important to dispel misinformation that may be out there, that sometimes can play on people's anxieties and fears in these very uncertain and confusing times of a shutdown. And I'm going to pass it to Olivia to share some ways that you can take action to hopefully help move us toward solutions that are going to benefit survivors and get us out of this shutdown.
Thank you so much, Lena. And I just wanted to really quickly highlight an action alert that NNEDV currently is promoting. I'm going to put this link in the chat. If you could click this link, you can just use our platform there to send a message to your members of Congress, just urging them to work together towards a bipartisan solution, which will ensure life-saving services for survivors without compromising healthcare. And so you can click on that link and it will help you send those emails. But if you have close personal relationships or want to make a phone call as well, we really recommend reaching out to your own members by phone, and especially those who you might have had contact with before, because those personal connections are always the most impactful. And then I'm also going to drop in the chat our toolkit, which currently has our language that we recommend in talking about domestic violence in relation to the government shutdown. Thank you so much to Elena and again for having us on this call today.
And I do think we have a few minutes, David, for questions if anybody happened to have any questions.
I'm not seeing anything come to the chat just yet. I'll give it another beat. I want to say how much I think this cross-sector conversation matters right now when, for example, the press is tracking whether and for how long public housing and vouchers will get paid for. And the rent payments that you talked about, Elena, are like a smaller set in number, but they really have outsized influence. And so for all the sort of housers and human services providers on the call, bearing in mind that these programs are on different timelines, but they're the same systems and people don't live single issue lives, right? That if you're working at a pantry, working at a shelter, doing any kind of public facing service, you may be interacting with survivors and folks who are impacted. So I think it just strengthens our advocacy to be keeping these connections in mind whenever we can.
I did see a question come in regarding, it said, are there groups, either local or national, we can be volunteering with on this cause? I definitely think, taking the actions that Olivia mentioned, it's immensely helpful to uplift this particular intersection. So we would greatly appreciate, our mainstream housing partners and advocates to be taking those steps to highlight the needs of survivors in all of this as well. And I would also say that a great first step that you can be taking is our member coalitions that are state and territorial domestic violence coalitions. They're a really great first stop. So if you Googled your state, or you can go directly to our website, nnedv.org, and we have our list of territorial and state partners, member programs, and they have local member programs, and many of whom have ways to volunteer directly locally. And so if you are kind of looking to be more engaged locally around this intersection of housing and meeting the housing needs of survivors, which, just fun fact, it is by many surveys and areas of research suggested to be the highest cause of family homelessness. So this is it's a really huge intersection that's often looked at in our mainstream field of housing. That's a really good place to start, is looking with your local member programs of your DV state or territorial coalition.
Fantastic. Thank you, Elena. We've told folks that yes, we will be sharing the links and the resources and the slides, so you will have access to those after the call. Lots of thank yous coming through in the chat now.
Thank everybody so much for being here.
Fantastic. All right. Thanks so much. We'll go to our next presentation. Let's see. Our guest name I have here in my notes, Carly Rumley, research and policy analyst with Children's Health Watch, here to talk with us about impacts of the government shutdown in the healthcare space. Carly, if you're ready, I'll pass it to you.
Sounds great. Thanks so much, David, and thanks for having me today. I'm really grateful to be here with you all. Going to talk a little bit about the impact the shutdown's having on healthcare. If someone's driving the slides and wants to go to the next slide, that'd be great. Thanks so much. So just a little bit of background on Children's Health Watch. Children's Health Watch is a network of pediatricians and public health researchers working to improve child health outcomes and advance health equity. And we do this by first collecting real-time data in hospitals across the country from low-income parents of very young children. We then analyze this data and share our findings, which help policymakers better understand the social and economic factors that impact child health. So, going to talk about the extended ACA premium tax credits. I've heard these referred to as APTCs. I've heard these referred to as EPTCs. They all are referring to the same thing, extended ACA premium tax credits. Just a little bit of background on what this is. So most people who are covered with plans through the ACA marketplace or Obamacare receive a premium tax credit. And this tax credit lowers their premiums, or the insurance word for the monthly cost that people pay for their healthcare coverage. In 2021, Congress enhanced this tax credit through an increase in eligibility expansion via ARPA. And the APTCs have made ACA marketplace coverage much more affordable, which has resulted in a record number of people gaining insurance through the marketplace. And this growth has been most concentrated among Black and Latino folks, folks with low income, and also folks living in states that haven't expanded Medicaid. However, the APTCs are set to expire at the end of this year in 2025, which means that people will be responsible for paying a larger share of their premium unless Congress acts. And that's what the shutdown is about currently. Just to give you a sense of the increase in premiums, it is quite significant if you wouldn't mind moving to the next slide. Thank you. I hesitate to use the word great here because it's quite shocking, honestly, to see these increases here, but this is a table put together by KFF, really showing how much these premiums will go up. So this is toggled to a family of 4. So let's just look at here, a family of 4 making $55,000 a year. Right now, they pay about $460 a month for their healthcare plan. If these tax credits expire, they will pay $2,800 for the same plan next year. So I don't need to tell you that this jump in price is significant, and likely families will be priced out of their healthcare coverage. You can go to the next slide. So what does this mean? What will happen? What's the immediate impact here? So on November 1st, families across the country will receive notification that their premiums are going to go up. Some states have already released this data. The last time I checked this morning, it was around 13 states, and maybe more states will release more leading up to Saturday, but for sure by Saturday, all states will release the 2026 premium numbers. As Elena mentioned earlier, really important point, at the same time that these premiums, that folks will find out that their premiums are increasing, some families are also expected to face a SNAP benefit cliff, as the USDA has so far signaled that they will not issue benefits amidst the shutdown. So for families, this is a compounded loss of financial resources and really threatens access to basic needs and care. We know that families have one already stretched budget. When costs go up in one area, such as healthcare in this case, families must make impossible choices between going to the doctor, paying for prescriptions, skipping meals, or foregoing other basic needs like rent, utilities, or mortgage payments. And for the healthcare system, the significant increases in premiums will likely put health insurance out of reach, which will lead to millions not enrolling in coverage during open enrollment, which starts also November 1st. The Center on Budget and Policy Priorities has estimated that over 4.2 million people who currently get their coverage through the ACA marketplaces will become uninsured. An increase in the number of uninsured patients will send ripple effects throughout the healthcare system. Children's Health Watch research and the research of many of our peers shows that foregone preventative care leads to more acute, expensive emergency room care down the line, which increases healthcare costs for everyone, not just people who have a marketplace plan, but everyone who uses insurance or is uninsured. And this also strains providers, as emergency rooms are meant to address acute care. And when folks have to go to the emergency room to seek preventative care, it creates longer waiting room times and clogs up the system. You can go to the next slide. So there is a week of action. So what can we do about this? There is a week of action being put on by Economic Security Project, which is one of our national partners. And the week of action starts tomorrow through November 5th, which includes the start of open enrollment November 1st. Economic Security Project has put together a week of action toolkit, which I know that these slides will be sent out to everyone. So that is a live link. In that toolkit is also includes a social media toolkit. I believe there's some press releases and suggested op-ed prompts that can help you start writing your story, sharing your story with the press. Also really want to second what Elena said earlier about connecting directly with members of Congress. If you already have relationships with them, I think this is really powerful. Healthcare is one of those issues that, it affects all of us. And I think all of us have a story to tell. And hopefully these resources that Economic Security Project put together can help you in deciding what you want to say. But yeah, happy to answer any questions that may have come up. And if I don't know the answer in the moment, I'm happy to find out and send David my thoughts. And yes, health is a human right. I see that in the chat. Absolutely.
Agreed. And thank you, Carly. We'll give a couple of beats for any questions to come in. I haven't seen any in the Q&A. Gratitude for the presentation. These are really critical issues. Okay, Carly, if you're able to stay on for a little bit, we may have folks who continue to formulate a question and get something into the Q&A.
Absolutely.
Would appreciate you hanging on. Thank you so much.
Thank you.
I'll take us to, oh, here we go. Oh, well, this is on the SNAP contingency reserve, not mine nor Carly's area. It is an interesting sort of, to my eyes, novel interpretation of the contingency reserve and the view that if we're not operating within a standard budget where Congress has appropriated funds, then they seem to be claiming they don't have the authority to disperse the contingency funds. I'll talk a little bit about some related topics. We could come back to the SNAP question. Hopefully won't have to in another couple weeks' time. So I'm just going to describe a couple of things here for you in the policy landscape that we're tracking. Our speakers have mentioned the first federal paycheck missed, the threatened cliff for SNAP benefits that we're staring down. And so I just want to mention a couple of other things that fit in a similar pattern. One issue we've been tracking where it's really more about the reductions in force that took place at HUD within the context of the shutdown is in HUD's REAC office, which is the office that schedules, oversees, and responds to and conducts some inspections of public housing, multifamily housing, a few different kinds of HUD-assisted housing. And this office within HUD was hit particularly hard by the newest round of RIFs, reductions in force, RIFs, as well as the Office of Fair Housing and Equal Opportunity. We heard from some staff whistleblowers from that office on a previous call. The inspection story has been covered in some press outlets. So I just want to describe for this group that HUD staff carry out inspections in some parts of the country. They inspect certain properties. There are contractors who carry out inspections at other properties, and some of those inspections continue to take place. The issue will be what happens when there's a finding as an inspection at a property. So the property needs to fix something or make it right. The contractors that have continued to work at some capacity during the shutdown are not an enforcement arm and don't have the same expertise that the staff at HUD do to verify that the issue has been remedied. So that's one sort of ramification of the reductions in force across that office. So we're continuing to talk with our partners. If you are aware of delayed inspections or issues getting an inspection scheduled, or a property where there have been findings and it's not clear what path the owner or operator needs to take to remedy those findings because the HUD engineering staff that were uh, reviewing those cases are no longer working. We would love to hear from you. It's kind of an abstract story and somewhat difficult to tell to make clear to decision makers what's at stake. It's really when you all have knowledge on the ground of how this is affecting communities and tenants and families in your neighborhoods that we're able to catalyze action. So I wanted to mention that issue around the inspections. The last thing I'll mention for my portion here is there have been a number of communications from members of Congress to the administration within the last week that I think you should all keep your antenna up about. So a week ago, a group of 105 members of Congress, all Republicans, sent a letter to Treasury Secretary Bessent and to the OMB director decrying the reductions in force within the CDFI program. So within the Treasury, Community Development Funds, that program had experienced large reductions in force, and these members of Congress who know that their voters in their districts benefit from those programs wanted to let the Treasury Secretary know that was a problem and that they wanted to see a fix. This morning, Politico reported 22 Republican members of Congress, led by 2 representatives from New York, reaching out to the HUD secretary and asking that the Continuum of Care program be renewed for a second year. Again, we heard on a previous call here from National Alliance to End Homelessness about this issue, and we now have Republican members of Congress standing up to say, this is not the time to upend the COC program. We should just renew existing projects for another year and not either put out a NOFO or try to affect policy changes this year. So if your representatives are, attached to one of those letters, you note that, and there may be other opportunities to get them to stand up for preserving the programs that people in our communities rely on. So with that, I'll hand it over to Ramina Davidson, our VP for Field Strategy and Innovation.
Thank you so much, David, and really appreciate all the updates from folks, what folks are working on, the potential harm that's coming. And also, to me, it was really energizing to hear what folks are doing. So a lot of attorneys general, caring about SNAP benefits, a lot of folks in Congress writing to the administration, as you were talking about. And I'm here at the end of this call to talk to you all about strategizing for action. We've talked a lot about how you can contact your decision makers and policymakers. And one of the things that we're working on at NLIHC is how to connect you all together and with us to start working on things like strategy, collaboration, and figuring out what ways you all would like to be connected to each other. Can you go ahead and hit the next? Thank you so much. So these calls in general, as we have every 2 weeks, are open. We discuss a lot of information and we share a lot with each other. And one of the things that we're starting to do is kind of creating thank you, Georgette. Starting to create kind of a different area where folks who are vested and really interested in doing kind of strategy work and working together on a variety of issues can come together to do that in a space that's safe and a space where you can talk to each other. We've heard from a lot of folks, if you were on the last call, you've heard me say this, but we've been hearing from a lot of folks that y'all would like to be able to connect with each other in your own state or your region, or like to connect with folks in the same kind of political environment. Or we've heard about folks who are tenants who want to get involved in areas and opportunities to kind of join together to do that. And we are interested in assisting with that, setting those tables with you all so you can have places to plan and strategize. Can we add the QR link in the chat? I think we can, but the QR link really is our email address, our outreach email address. If you are interested in participating in these, can someone just add the outreach email in the chat? Maybe if I could do it. Please just email us and tell us. Thank you so much, Lindsay. If you all want to do that, either take a picture with the QR code right now, either do it with the just being able to do it in the chat itself. We'll talk to you about how else you all can get involved in these kinds of conversations and in these kinds of tables. So that is really kind of my spiel. If y'all are interested, we will connect with you and kind of bring you to a space where we can do that work together. There's a lot of ways to get involved, as David was kind of talking about, and this is one of those ways. I know we've got a lot of time kind of left on this call. I'm happy to, I know y'all can't come off mute, but I would be really interested in ways you all would like to connect with each other, if that's of interest to you all, as you are kind of emailing us right now. But would it be of interest to do these things with you? Yes, and thank you so much. I think that's on the next slide. One of the things that we are also working on in these, is there a social media page we can connect on? That's a really great question, Brian. One of the ways, thank you so much. We're actually working on some of these things, like what ways do you all want to connect and interact with each other? And so we'll kind of discuss that in the background. And these kinds of activities and these tables that we're setting with you all, we want to make sure they're as protected as possible. And so we would like to also mention, trying to read through all the, thank you so much, Sarah. This is really kind of one of the perks of National Income Housing Coalition membership. So if you all are interested in membership, this is really kind of a perk of ours to be able to connect you all with each other and to us to do these kinds of strategy sessions together. Signal or Discord, absolutely thinking about that. Hi, Crystal. I thank you so much, Lindsay. I'm so bad with putting links in the chat, but really, really appreciate that. So thank you all. I don't know if y'all have any questions for me about this. I know we had a pretty quick, snappy call today, which I love. But if not, you'll all have to see me again next time. I will do this again. Thank you, David.
We did. I've got just a couple folks with Q&A in the chat here. I want to encourage anyone with questions about how to connect to resources locally to use. I think that outreach at nlihc.org email box, and we'll make sure that our field team member who works in your part of the country can point you in the right direction if you let us know where you're based. I want to thank our guests again for helping to paint that bigger picture of what's happening in the shutdown, for all of our neighbors, not just through the housing lens, but thinking about domestic violence, health, food insecurity as well. And we look forward to seeing you all in another couple of weeks. Take care of yourselves.